Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about sinusitis. So what is sinusitis? It is inflammation of paranasal sinuses. It is inflammation of paranasal sinus. So according to duration, we'll divide it into acute, subacute, chronic and recurrent. If the inflammation is less than 3 weeks, we'll call it as acute sinusitis. Subacute when it is from 3 weeks to 3 months, and chronic when it crosses 3 months or 12 weeks. Okay, so this is acute, subacute and chronic sinusitis. What is recurrent sinusitis? When there is 4 or more episodes per year and each episode is lasting for more than 7 to 10 days, it is called recurrent sinusitis. Which is the most common sinus that is affected in adults is maxillary sinus, and most common sinus that is affected in children is ethmoid sinus because it is most pneumatized. If someone asks you which is the least common sinus affected is sphenoid because of its location, that is posteriorly located. So this was about the introduction of sinusitis. Now coming to etiology of sinusitis. Pathophysiology is very simple. Suppose this is the sinus, frontal sinus, mild sinus, maxillary sinus. There is an ostia, and if there is any blockage of the drainage, it can lead to sinusitis. Okay. So what are the exciting factors that causes sinusitis? The first thing is nasal infections. Most acute sinusitis starts with as viral infections and followed by bacterial invasion. Okay, so first there was viral infection, afterward bacteria invaded there. Second is swimming and diving. Third is trauma, and fourth is dental infection. Very important cause, dental infection, and it infects maxillary sinus and with mixed infection, that is aerobic and anaerobic infections. If someone asks which is the most common bacteria for acute sinusitis, we have to tell Streptococcus pneumoniae. Streptococcus pneumoniae. What is the predisposing factors for sinusitis? The first thing is obstruction of sinus ventilation and drainage. Obstruction of sinus ventilation and drainage. Stasis of the secretion in nasal cavity. Okay, so the drainage was blocked, so there will be stasis. Okay, and this is like one causes cystic fibrosis or can be due to ciliary dysfunction. The other predisposing factors are allergy, causing mucosal edema. Okay, what are the systemic factors involved in sinusitis? If there was attack of exanthematous fever like measles, chickenpox, whooping cough, if there is some nutritional deficiency, and if immune deficiencies are there, these are the predisposing factors for sinusitis. Okay, so now coming to the bacteriology, which bacteria are involved. So I've told you that Streptococcus pneumonia is the most common, then H. influenza, Moraxella, Streptococcus pyogenes, Staph aureus. These are the infections. For sinusitis due to dental origin, there will be mixed infection, anaerobic plus aerobic. Okay. The dental causes mainly affects maxillary sinus. We have told in here also. Okay, maxillary sinus. Now, here, what are the dental procedures? Now, if there is infection that is secondary to infection of first molar and second premolar tooth, okay, first molar and second premolar, if there is infection, that can go to the maxillary sinus, or oroantral fistula following tooth extraction may also be a cause for sinusitis. Okay, oroantral fistula following tooth extraction. So tooth extraction and infection of first molar and second premolar tooth. Okay, so dental infections are very fulminating and result in suppurative sinusitis. Okay, so till here we have seen about the normal introductions, clinical features of the sinusitis. Now we need to learn about the clinical features of acute sinusitis. Very important thing. What are the clinical features of acute sinusitis? So we have some major criteria and then we have some minor criteria. Okay, first we'll see the minor criteria. Okay, so along with sinusitis, what things can be there presentation as? First one is headache, cough, halitosis, ear pain and pressure, and dental pain. Okay, so 2H, 2 pain and cough. So 2H means headache and halitosis, 2 pain means ear pain and dental pain, and 1 cough. Okay, so minor criteria is 5: 2H, 2 pain and cough. So halitosis is bad smelling breath. Okay, so this was the minor criteria. Coming to the major criteria, we have nasal obstruction or facial pain or pressure. Then we have purulent nasal discharge. We have fever because of the infection, nasal congestion, hyposmia or anosmia, and facial congestion or fullness. So this is the major criteria for acute sinusitis. Now for diagnosis, if there is two major criteria, we can diagnose as acute sinusitis, or if one major criteria and two minor criteria are there, we can call it as acute sinusitis. Okay, so again you must know, you must learn this major criteria and the minor criteria of acute sinusitis. Now let's learn about the difference in symptoms when different kinds of sinuses are involved. Okay, suppose in maxillary sinus what will happen, in frontal sinus what is the symptoms, in ethmoid and sphenoid what are the symptoms. Okay, what are the differences? So if you keep the location of these sinuses in mind, it is very easy for you to differentiate them. Okay, so now the symptom is headache or pain. Okay, so for maxillary sinus, usually the headache or pain is seen over the cheek and forehead. Okay, so the most common pain is cheek because maxillary sinus in the cheek area. Sometimes it can be like headache or pain is in the forehead area. Okay, tenderness again because cheek will be there. Maxillary area is very in close proximity to the cheek, so canine fossa is involved. Redness and edema again in the cheek. Okay, the site of discharge is middle meatus. The site of discharge is middle meatus, and the early complications can be orbital cellulitis, osteomyelitis, and frontal sinusitis. So if you keep in mind the location of sinuses and the draining area, like where it is draining in the middle meatus or the superior meatus, where it is draining, so it is very easy for you to know. Okay, so on examination you can see the nasal discharge in the middle meatus. On tenderness you can see over the cheek, redness and edema over the cheek, and pain in the cheek. So this was about the maxillary sinusitis. Coming to frontal sinusitis, very simple. The pain is localized to the frontal sinuses, and that is above the medial canthus. Okay, the pain is above the medial canthus. So if you know the location of frontal sinus, it is easy. Tenderness again in the floor of the frontal sinus or over the floor of the frontal sinus, and redness and edema is seen in the upper eyelid. Okay, so there is upper eyelid puffiness. Site of nasal discharge is very easy to remember if you remember the drainage of frontal sinus. So here we'll be having vertical streak of mucopus high up in the anterior portion of middle meatus. So here also middle meatus, but there will be vertical streak of mucopus high up in the anterior portion of middle meatus, and the complications are almost same, but here we can see the intracranial abscess also. Okay, so this was about the frontal sinusitis. Coming to ethmoid sinusitis, so the headache or pain will be in bridge of the nose, medial and deep to the eye. Okay, so headache and pain is in the bridge of the nose and medial and deep to the eyes. Tenderness is again in the bridge of the nose. Okay, you can press on that bridge of the nose, you can feel the tenderness. Redness and edema, both eyelids become puffy. Both eyelids become puffy, mainly to the medial sides. Site of nasal discharge. Okay, so here ethmoid we have anterior ethmoid and posterior ethmoid. So mainly the middle ethmoid is seen in anterior ethmoid sinus. Okay, so here we have to see the nasal discharge from superior meatus. Okay, superior meatus. So it depends upon which ethmoid is involved, anterior ethmoid or posterior ethmoid is involved. Okay, very important point remember is here in complications of ethmoid, the point is there can be chances of vision loss. Okay, vision loss chances are there, and cavernous sinus thrombosis chances are also there in ethmoid sinusitis. Okay, that's the complications. Coming to sphenoid sinusitis, the pain is in the occiput or vertex. Simple. The pain is in the occiput or vertex. You cannot find the tenderness, redness, or edema in that thing. The site of nasal discharge is seen on the posterior rhinoscopy. Okay, it is not normally seen. It is seen on posterior rhinoscopy on the roof and posterior wall of nasopharynx. Okay, and they have posterior nasal discharge. Okay. So if we'll just summarize the discharge, like from where the discharge is, in middle meatus we have discharge from the frontal sinus, maxillary sinus, and anterior ethmoidal sinus. Okay, so maxillary sinus, frontal sinus, and anterior ethmoid sinus we have where we'll see the discharge in middle meatus, whereas in posterior ethmoid we'll see the discharge from the posterior ethmoid sinus, where in superior meatus we'll see the discharge from posterior ethmoid sinusitis. Okay, and in sphenoid sinus we can see the post nasal drip. Okay, so this was about the difference in symptoms and signs depending upon the sinus involved. Now, to differentiate maxillary sinusitis from frontal and ethmoidal, anterior ethmoidal sinusitis, we have postural test. Okay, so we have postural test. Simply clean the pus in the middle meatus. Okay, put the patient's head lying on the opposite side, okay, on the later recumbent side. And if again it will come, okay, there will be reappearance of the pus, it is from the maxillary sinus. Very simple. We have cleaned here the sinus, okay, and head is tilted on the opposite side. There is stasis in the maxillary sinus, and from this stasis it can come from this sinuses again. So there is reappearance, and if there is reappearance, it is from the maxillary sinusitis. Whereas this variation in posture will not cause any discharge from anterior ethmoidal or frontal sinus. So if there is no reappearance of the pus, then suppose it is in the frontal and anterior ethmoidal sinusitis. Now, if there is no reappearance on tilting the head either sides, now we have to ask the patient to sit in head hanging position. Okay. Now you can imagine the position of sinuses. If you know, then it is very easy for you to remember these tests. Now if the patient will be in head hanging position and there is reappearance of pus, okay, you can say that it is from the frontal sinusitis. Okay, from frontal directly there is appearance on head hanging position. If again there is no reappearance, now you can exclude the maxillary sinus, you can exclude the frontal sinus, and you can say it may be because of anterior ethmoidal sinus. Okay, so this is how you differentiate between frontal, maxillary and anterior ethmoid sinusitis. So these were the tests and differentiating features of different types of sinusitis. Okay, now we'll see each sinusitis in detail. Thank you so much.